If you had a baby recently and now you're dealing with severe headaches, it could be very concerning. While some headaches are common during pregnancy, others can be more intense and worrisome after delivery. In this video, we will discuss the top 13 reasons why you might be experiencing severe headaches after giving birth. So if you're a new mom or expecting a baby soon, make sure to watch till the end to learn about these potential causes. Headaches after delivery, also known as postpartum headaches, can occur for various reasons. These may include complications from the delivery itself, hormonal changes, or underlying medical conditions. Some headaches are mild and resolve on their own, while others may require medical attention. It's important to seek prompt medical advice if you experience severe or persistent headaches after delivery, as they could indicate a serious underlying issue. Now, let's get into the details. Number 1. Postpartum preeclampsia. Postpartum preeclampsia is a rare but potentially serious complication that can occur after delivery, although it usually occurs within the first few days after childbirth. This condition involves persistently high blood pressure and signs of organ damage, often in the liver and kidneys. Symptoms of postpartum preeclampsia include severe headaches, especially if there's sudden and persistent high blood pressure, vision changes, and upper abdominal pain, particularly on the right side. With per out with a Number 2. Eclampsia. As mentioned earlier, eclampsia is a severe complication of preeclampsia. This condition involves seizures and convulsions, making it crucial for prompt medical intervention. Women who develop eclampsia typically display symptoms such as persistent headaches, particularly those that worsen suddenly, changes in vision, swelling in the hands and face, and high blood pressure. Immediate treatment for eclampsia often involves the administration of anti-seizure medications and close monitoring until the condition stabilizes. Number 3. Postdural puncture headache. Postdural puncture headache, also known as PDPH, is a type of headache that can occur after an epidural injection during labor and delivery. This condition arises when the dura, a protective membrane surrounding the brain and spinal cord, is accidentally punctured by the needle used for the epidural anesthesia or spinal block. When this happens, cerebrospinal fluid can leak out, putting pressure on the brain and causing a severe headache. The severity of PDPH can vary, and some women may even experience persistent headaches for several weeks or months. While not all women undergoing epidural anesthesia develop PDPH, it's essential to be aware of this potential complication. Number 4. Migraine. Migraines are severe headaches that often affect one side of the head and are accompanied by other symptoms like nausea, vomiting, and sensitivity to light and sound. While migraines can occur during pregnancy, many women find that their migraine patterns change after delivery. In fact, some women who did not suffer from migraines before pregnancy may develop them post-delivery. Hormonal changes during the postpartum period can trigger migraine attacks in susceptible individuals. If you have a history of migraines and notice that your headaches worsen after delivery, it's essential to consult with your healthcare provider. Number 5. Tension headache. Tension headaches are the most common type of headache, and they can occur during the postpartum period. These headaches often feel like a tight band or pressure around the head and may be caused by physical stress and tension. Labor and delivery can be physically demanding, and many new mothers report experiencing tension headaches as a result of the strain on their bodies during childbirth. Additionally, sleep deprivation and the constant caregiving demands of a newborn can contribute to muscle tension and trigger headaches. To help alleviate tension headaches, ensure you get enough rest. Stay hydrated and practice stress, reducing techniques like deep breathing or gentle massage. Number 6. Sinus headache. Sinus headaches can occur during the postpartum period due to changes in hormone levels or nasal congestion. These headaches typically affect the areas around the nose, cheeks, and forehead, and are often accompanied by a stuffy nose or facial pain. During pregnancy, hormonal changes can cause the blood vessels in the sinuses to widen, leading to increased pressure and a feeling of pain. After delivery, a drop in hormone levels can cause those blood vessels to constrict, which can trigger a sinus headache. Additionally, nasal congestion from breastfeeding or exposure to allergens can irritate the sinuses and contribute to headache development. To find relief from sinus headaches, consider applying a warm compress to your face, staying hydrated, and using a humidifier or saline nasal spray to reduce inflammation and promote drainage. Number 7. Cerebral venous sinus thrombosis. Cerebral venous sinus thrombosis, also known as CVST, is a rare but serious condition that can occur during the postpartum period. This condition involves the formation of a blood clot in the veins of the brain, which can cause significant complications and potentially life-threatening consequences. CVST typically presents with severe headaches, especially in the right side of the head, along with symptoms like seizures, weakness or numbness on one side of the body, and changes in vision. While CVST is relatively uncommon, it's crucial for new mothers to be aware of its potential signs and seek immediate medical attention. If they suspect they may be experiencing this condition, early diagnosis and treatment are essential to prevent further complications and ensure the best possible outcome. Number 8. Postpartum hypertension. Refers to elevated blood pressure after childbirth. This condition can occur in some women following the delivery of their baby and may lead to headaches, along with other potential complications. While occasional fluctuations in blood pressure are common during the postpartum period, persistent hypertension can signal an underlying issue that requires medical attention. New mothers who experience persistent headaches, alongside other symptoms like shortness of breath, dizziness, or changes in vision, should consult with their healthcare provider promptly. Early detection and management of postpartum hypertension are vital to prevent potential long-term risks for both the mother and the baby. Number 9. Dehydration. Dehydration can lead to headaches, especially during the postpartum period, when women may experience significant fluid loss due to factors like labor, breastfeeding, and restricted fluid intake. It's essential for new mothers to stay adequately hydrated to prevent dehydration-related complications. To maintain proper hydration, aim to drink at least 8 glasses of water daily. Monitor urine output to ensure sufficient fluid intake and consult with your healthcare provider if you notice any signs of dehydration, such as decreased urine production, dry mouth, or sunken eyes. By staying well hydrated, you can help reduce the risk of dehydration-related headaches and support overall health during the postpartum period. Number 10. Anemia. Postpartum anemia occurs when a woman has a lower than normal level of red blood cells or hemoglobin in her blood after giving birth. This condition can happen due to blood loss during childbirth and is common, especially in the first few weeks after delivery. When a woman experiences anemia, her body may not have enough red blood cells to carry oxygen to her organs and tissues, leading to symptoms such as fatigue and headaches. To help prevent or manage postpartum anemia, ensure a balanced diet rich in iron and other essential nutrients. Consider taking iron supplements as recommended by your healthcare provider and monitor your symptoms closely. If you notice any signs of anemia, don't hesitate to seek medical advice and treatment. Number 11. Intracranial hemorrhage. An intracranial hemorrhage, also known as an internal brain bleed, is a serious medical condition that can occur in the postpartum period. This condition happens when there is bleeding within the skull, which can put pressure on the brain and cause life-threatening complications. Intracranial hemorrhages can cause severe headaches, especially when they occur suddenly, along with symptoms like nausea, vomiting, confusion, and changes in consciousness. While intracranial hemorrhages are rare, they are a potential concern during the postpartum period. If a woman experiences a severe headache, especially one that comes on suddenly, it's essential to seek immediate medical attention, as prompt diagnosis and treatment are crucial for the best possible outcome. Number 12. Tension from stitches. Postpartum tension headaches can arise from the stress and strain on the muscles in the head, neck, and shoulders. This tension can be particularly prevalent in cases where episiotomy stitches or cesarean section incisions are involved. During labor and delivery, the body goes through significant physical stress, which can lead to muscle tension and discomfort.
For instance,
The perineal area can experience stretching and tearing during vaginal delivery, while C-section incisions can also contribute to muscle tension. This tension can persist after delivery, potentially leading to headaches in some women. To help alleviate tension headaches in this context, focus on getting plenty of rest, staying hydrated, and practicing relaxation techniques. Gentle massage or applying a warm compress to the back of your neck may also provide some relief. Number 13, postpartum thyroiditis. Postpartum thyroiditis is a condition that can cause inflammation of the thyroid gland during the postpartum period. This inflammation can lead to hormonal imbalances, affecting the thyroid's ability to produce hormones that regulate metabolism. Symptoms of postpartum thyroiditis include headaches, along with fatigue, mood swings, and changes in energy levels. If you suspect you might have postpartum thyroiditis, consult with your healthcare provider for proper diagnosis and management. Treatment options may include thyroid hormone replacement therapy or anti-inflammatory medications to help control symptoms and restore thyroid function. While some postpartum headaches are mild and can resolve independently, others may indicate a more serious underlying issue. If you experience a severe or persistent headache after delivery, it's essential to consult with your healthcare provider promptly. By understanding the potential causes and recognizing the signs of complications, you can work with your doctor to determine the appropriate course of action, ensuring the best possible outcome for you and your baby. Remember, your health and well-being are crucial for providing the best care for your newborn. Do not hesitate to reach out to your healthcare team. If you have any concerns or questions regarding headaches or other postpartum symptoms, they are there to support you and your baby during this significant time.